Well, the weather is turning cooler, which means it is almost time to trade in those flip-flops, those comfortable sneakers for the boots, for the shoes again. The end of summer coming, unfortunately. Before we do that, though, you might want to give your feet and your shoes a once-over just to make sure they're ready for the fall and winter transition. So joining me now to talk about her fall feet fixes is Dr. Krista Archer, foot surgeon and podiatrist. Thanks for being with us today. All right, so we've been enjoying the flip-flops and everything else that's casual and relaxing, but now we have to get back into shoes and boots. So what do we need to do?
So you want to check your skin before you commit to socks and shoes for the next 2 seasons.
Right.
You just want to give the tops, the bottoms, and in between the toes a once-over. Check for new freckles that maybe change shape.
Which is not something that a lot of people would think about.
No, especially in your feet. I mean, you should be wearing sunblock all summer long. And
right.
Even still, something might pop up that you're not used to seeing. Get it checked out by a doctor.
Okay.
Check in between your toes for any itchy skin, cracks. Your heels, check for cracks.
Okay.
A lot of people wear flip-flops and sandals all summer long. So
which dries out a lot.
Dry,
you're out on the beach.
sun, the
right.
sand. Look, most people have cracks, so you want to make sure you do a hydration, exfoliant treatment, get rid of the cracks. You want to check the bottoms of your feet for any new calluses that popped up all of a sudden.
Okay.
Those could be warts.
Oh, okay. All
yeah,
right.
so you want to get warts treated.
Obviously not pleasant, but not to be ignored.
Right.
All
Lastly, you want to check your nails. Women, take your nail polish completely off.
Okay.
And look at the color and the texture of your nails.
Okay. All right. Now, you're also going to be going from outdoor exercises and workout routines back to the gym. What do we have to look for there?
Check your running shoes.
Okay.
Your running shoes don't have an infinite number of miles in them. They get worn out. So check.
I know so many people, they just keep running and running, either until the shoes smell or they start falling apart.
So check the outside, check the soles, check the inside. Are they dirty? Are they broken down?
Okay.
If they're worn out, just get rid of them.
Okay. And then from sandals to boots and shoes, because sandals have absolutely no support whatsoever.
And they're flat, so people are wearing flip-flops all summer long.
Right.
Then they get back into their fall routine, and they're changing in the heels and the boots more often. So your Achilles tendon is changing length functionally up and down, and the constant change can lead to Achilles tendonitis.
Okay.
So you want to do stretching.
And same thing with boat shoes as well, because I know a lot of people don't wear flip-flops or sandals. But if you're wearing like boat shoes, docksiders, things like that,
they're flatter than a dress shoe with a heel.
Right.
So you want to make sure you incorporate stretches into your gym routine when you're back inside.
And oftentimes with boots, now that we're going to be in winter, snow, I mean, no one wants to hear that.
No.
But that's going to be coming around the corner, and you got a good, inch or 2 inch heel or something like that to keep it waterproof and up and out.
Yeah.
That's going to be putting a lot more pressure on the bottom of your foot.
Right, exactly.
Okay.
Where the Achilles tendon attaches to the heel bone in the back of your leg.
Okay. And then also for women as well, because a lot of women have going to be going from flip-flops
to heels.
Now.
Fall, there's tons of cute fall peep toe heels. You want to make sure your Achilles tendon stays flexible. So make sure you do back of leg stretches.
As a podiatrist, it's got to kill you when you see these heels, especially during fashion
week. I love them though.
Okay, yeah,
That's
but at
the
the
thing,
same
I love
time,
them.
they keep getting bigger and bigger and bigger.
So wear them, with caution when you're wearing them. You don't want to pound the pavement, go for miles in high heels.
Right.
Be sensible about it. But I would never tell a patient to swear off high heels.
Anything last people should be aware of then as we're making the transition?
Okay. Pedicures continue all year long.
Okay.
There's tons of cute colors for fall.
Okay.
The
for
deep
women
blues,
or guys.
Deep blues, greens, grays. You want to practice your safe pedicuring still. So 3 things I always advise patients to do. Make sure if you go to a salon that uses jets, make sure that they're adequately disinfecting the jet system. Bacteria and fungus can colonize deep in the pipes.
Okay.
Sometimes it's simpler and safer. Just go, the old school style of the basin. That could be switched out. Number 2, make sure that you bring your own instruments or that they're sterilizing the instruments.
Because you know where they've been.
Right, exactly.
All right.
And number 3, make sure you bring your own flip-flops to transfer from the chair to the dryer.
Perfect. All right, well, that's very good information. And again, it's something we don't often think about, the fact that we're going from a summer hot, dry flip-flops, and now everything's
Lots of contagious things happen in the summer with your feet. You want to make sure before you put them back into shoes that they're completely healthy. You don't want to be surprised in the spring when you take your socks off again.
Oh, yeah, those kinds of surprises. I give you all the credit in the world for dealing with those kinds of surprises that people like me often ignore, and we have to come to people like you to solve the problems. And also, you were saying if we've had shoes that have been in the closet for the entire summer, take them out, take a look at them, make sure there's no mold, anything like that.
Yeah, exactly. Get an antifungal spray, get some antibacterial soap with a sponge, take out the insert, and just clean it off.
Okay.
Bacteria and fungus, especially fungus, love dark environments.
Which is perfect for the closet environment.
Exactly.
Bring them out, get them all cleaned up.
Air them out.
All right. Dr. Archer, invaluable advice. Hopefully people won't have to see you if they follow these tips, but if they do, it's good to know that you're going to be there. All right. Thanks for being with us today.